well. So the prevalence is low. We have one of the lowest prevalences of the disease in the European Union at the moment. Hospital admissions are very low and ICU beds are very low at the moment. Testing and tracing is very good. In the last 7 days, we've done nearly 50,000 tests, and the tracing is ramping up. We've had more than 1.3 million people download the app, and please keep doing it. And we've introduced mandatory face coverings on public transport. So we have been doing well. The public have been doing well, and we have been well advised by public health experts.
So why the pause?
So they're very concerned. So they met yesterday. They wrote to me. They met with the Taoiseach, or rather the Chief Medical Officer met with the Taoiseach, met with me afterwards. This R number, which we're all very focused on, has gone above 1. They believe it's somewhere between 1.2 and 1.8. If it's 1.8, they believe that within about 3 weeks we could be up to 150, 160 cases per day, which obviously is a completely different place we don't want to be in. There have been some big clusters. There's a key measure they look at, Brian, which is the 14-day cumulative cases. So, so the total number in the last 2 weeks per 100,000 population, that's gone up from 2.5 cases to 3.9, so a big jump. They've also cited the 5-day average. That's gone up from an average of 9 new cases a day to 22 new cases a day just in the last 3 weeks.
So is this possibly potentially the start of a second wave?
Well, their advice to us yesterday was essentially in order to stop that happening. So what have they advised? They have advised that we move the original phase 4 start date back to where it was meant to be, or where it was originally planned, which was the 10th of August.
Before the reopening was accelerated by the previous government.
That's right.
Did we just move too soon to reopen then?
No, I think what happened is, when the public health experts said things are going particularly well, the prevalence is falling, the clusters are falling, the R rate is below 1, there was a public health rationale for accelerating, and therefore we did accelerate, because we want, nobody wants these restrictions in place. And now that the prevalence has gone back up, the R rate has gone above 1 and so forth, the public health advice is slow it back down again. So the previous government and this government are following the public health advice, which has served the country very well. And at the moment, very strongly, that is, we need to slow down. There are additional measures they have advised, which we have agreed with. One is that people wear face coverings in retail. Now, the advice is from right now that happens. We will bring through regulations, but the advice is that we all begin to do that right now.
There is regulation to back up that requirement on public transport with penalties if you don't. Something similar will be coming along in relation to retail outlets.
It will, but the reality is the huge solidarity and the very clear understanding we all have, and the awful consequences of this, and the horrific human toll that this virus takes, means that on the first day on the buses, for example, 9 in every 10 passengers arrived with a face mask. And you can be sure that many of the 1 in 10 who didn't, some can't wear them, some simply forgot them on the first day. So if we continue as we have been, my hope is that there would be no need for enforcement whatsoever. We are in this together, and we will continue to suppress this virus together.
Right. In relation to the rise, the reported rise in the number of infections and clusters associated with activity, people gathering in private homes. Now, that seems to be a particularly significant element of this. How is that going to be tackled? How is that being tackled?
So what we're doing now is taking the NEFIT advice, taking the public health advice to limit gatherings in homes to no more than 10 visitors. So to be clear, it's not 10 people. So if there's 5 of you living in the house, then you can be up to 15. NEFIT have said from no more than 4 additional households, which is, I guess, a bit of additional complexity for us to bear in mind. But essentially, whoever's living in the house plus up to 10 people.
Because it's gatherings in private houses that are contributing. Is this the case to this rise that we've seen, or at least they're a significant contributor?
That's right. There have been some very serious clusters that the public health officials are very worried about. And, they've walked me through some of the cases, and actually it's really very sobering, Brian. So what you can have is you can have one person who is infected, but they're asymptomatic. They don't know they are. They go to a house party. Everyone's talking loudly. There's plenty of droplets going out into the air. You can end up with 20, 30 people walking out of that house infected. And so what we want to do is we want to make sure we protect everybody. And remember, it can be days and days before any of those people know that they are infected themselves.
But if the problem is in private houses, why are the pubs being told they can't reopen as planned from Monday?
NEFIT has looked at the international evidence as to what has happened in other countries. And what it tells them is that when restaurants opened and when restaurants were following the public health guidelines that we have here and that are being followed here, it hasn't led to an increase in cases. The evidence on the pubs is different. The evidence internationally that NEFIT have seen is that when the pubs have opened, actually it has led to a serious rise.
But that's not been our experience, because the pubs, some pubs, those that serve food, have reopened, and I don't think there's any problem been associated with that.
So the Chief Medical Officer was asked exactly this yesterday, and what he said was, from a disease perspective or from an epidemiological perspective, they're not saying it's restaurants and gastropubs. They're saying it's restaurants. And if the pubs can act as restaurants, then they're restaurants. But what they're based on the R value and based on what they're seeing abroad, they're saying now is not the time to open the pubs, and we just need to bring it back to the original start date.
It's just that so many pubs around, particularly in small rural communities, they're very often the heart of the community, aren't they?
They really are.
They might often have just a handful of people in them on a Thursday night. And it seems there's a kind of one-size-fits-all approach to this. Pubs, nightclubs, which are a very different kind of proposition, they're also remaining closed. There's no flexibility.
Yeah, nightclubs I think are a very different proposition for all the reasons we would
But
understand.
pubs are being treated the same way.
All pubs are being treated the same. That's the public health advice. And can I say, this is not easy. This was not an easy decision to make. We are following the public health guidelines. Essentially, we are prioritising the opening of schools, the opening of healthcare facilities, the opening of the economy over the accelerated opening of the pubs. And can I say this morning, this is not done lightly. We really do understand that there are publicans all across this country who were waiting and hoping that they'd be able to open on Monday. It hasn't been done lightly, but the public health advice is, were we to open them right now, it could materially add to the possibility of a second wave, and that's just not a risk we can take.
And the prospect or the likelihood of looking at perhaps regional differences, again, taking that into account, with parts of the country that have had reported very few cases over a period of weeks, and they're saying, why are these restrictions being applied here when our experience of the pandemic is very different to what people in large cities around the country might be having to confront?
Yeah, and I think that's a very understandable and reasonable question for people to ask. What we do have, of course, is the prevalence of cases county by county. There is some thinking going on at the moment around the long-term strategy, because unfortunately we're going to be living with this awful disease probably for quite some time, and certainly the options of regional variants are being looked at. Right now, the advice from NEFIT is that it applies across the country.
And does the next phase of reopening on August the 10th or whenever, does it depend on this R number coming back down below 1?
In part it will.
Yeah.
The Chief Medical Officer and NEFIT will be in a better position to explain, but their view is they take everything in the round. So it's not one number, it's not one fact. It's in the round. Where are we going, and are we moving away from a second wave, or are we moving towards a second wave?
Let me just ask you finally, the couple of minutes that remain, about political matters. The sacking of Barry Cowan, his refusal to come before the Dáil as requested by the Taoiseach to make a further statement in relation to this drink driving conviction. Do you think at this stage Barry Cowan should still come before the Dáil and give an account of what happened, particularly what he told Micheál Martin and when about all of this?
I think really, Brian, that's a matter for Barry Cowan and it's a matter for the Taoiseach. I don't imagine there'll be too many people looking for that, given the very serious consequences for Barry. Barry has served his country for many years. He has worked very hard, and without prejudice to the incident, on a human level, what has happened, it must be incredibly difficult for him, incredibly difficult for his family. So for now, I would say that Barry should be afforded just a bit of time. He has had to deal with the most serious of issues in terms of his political career. I think he should be afforded a bit of time, given that he's no longer in cabinet. I don't imagine too many people would be looking to follow that up.
You see, the Taoiseach has now conceded he knew on the 5th of July about this Pulse report, which suggested that Barry Cowan had tried to evade the Garda checkpoint in some way or that's something which he denies, obviously. But Mr. Martin only acted when all of this became public.
Yeah, to be honest, I haven't been following the hour by hour. I've been focused on NEFIT and COVID and exactly what we could and could not announce last night, and thinking forward to the green list. So I haven't forensically been following who knew what in what hour. I do know that it is a decision that won't have been made lightly. It will have been a difficult day for Barry, and it will have been a difficult day for the Taoiseach. Obviously, that's not something that he will have wanted, or that Fianna Fáil will have. This is not at all a situation the party would have wanted.
Minister Stephen Donnelly, thank you very much indeed for talking to us here on Maureen Ireland. The time just gone 23 minutes past 8.
And we are joined now by Dr. Karina Sadlier, consultant in infectious diseases at Cork University Hospital. Dr. Sadlier, you're welcome to Morning Ireland. What do you think of this decision to pause the reopening from Monday?
Good morning. Well, I think the decision to pause the transition to phase 4 is the correct decision. I suppose I realise it has been a tough decision for the government to have made from an economic perspective. Clearly, it's extremely difficult